In this lecture, we will learn about bone development and ossification. First, let's talk about bone development. Initial development of the skeleton occurs by bone replacing primitive connective tissues. The first bone to be formed is woven bone. Woven bone undergoes remodeling and resorption to form the mature skeleton. The initial connective tissue scaffolding that is formed by two types of connective tissues. One is the mesenchymal tissues and the other is cartilage. This bone forming process is called ossification because the initial connective tissue scaffolding is in two forms. You have two types of ossification as well. The two types of ossification are intramembranous ossification and cartilaginous ossification. Let's talk about intramembranous ossification first. The scaffolding is made out of condensed mesenchymal tissues. Mesenchymal cells then differentiate into osteoblasts. The osteoblasts, they start to lay down bone at different sites. That means the osteoblast secretes the matrix and the fibers that form the bone. And later the matrix gets calcified. These sites where osteoblast starts to lay down bone is called Ossification Centers. The newly laid down bone matrix starts to calcify. Osteoblasts get surrounded by the calcifying bone and become osteocytes. Each of the ossification centers that lay down bone in the periphery, and finally they all meet up to complete the ossification. This is a micrograph H&E section showing you the different sites of ossification. In pink, you get the newly laid down bone and you see the mesenchymal cells in the periphery. So the mesenchymal cells form the scaffolding and the osteoblasts are formed, and osteoblasts lay down or produce the bone matrix and then get trapped within the bone matrix when the bone matrix calcifies. So these cells now become osteocytes. Here again you can see all the osteoblasts in the periphery, the newly laid down bone in pink, and the osteocytes now which are trapped in the bone matrix. Here is a diagram to show you intramembranous ossification. In the first picture, you can see condensation or the coming together of the mesenchymal tissues into a soft sheet, and this sheet is permeated or broken into parts by the blood capillaries. Then you get osteoblasts in the center, periphery, and they start to lay down the bone matrix. Then the osteoblasts get trapped inside the matrix as osteocytes and they give rise to the trabecular parts of bone, calcified osteoid tissues. Then there are gaps inside these places where you have trabecular formation in the center. Then minerals are deposited in the matrix. Now, intramembranous ossification is usually seen in the skull bones, produces flat bones of the skull and clavicle. In these bones, you have compact bone on either side, and spongy or cancellous bone in the middle. So the blood vessels also grow into this medullary cavity. So this part will be the medullary cavity and outside is the compact bone. This is a special slide to show you intramembranous ossification. It is seen in the vault of the skull, mandible, and the clavicle. So these sheets of bone in the skull are initially made in mesenchymal tissues, similar to mesodermal tissues, and then they are replaced by new bone. Now let's talk about cartilaginous ossification. Here the scaffolding is formed by hyaline cartilage. Then this cartilage is systematically replaced by bone. This permits functional stressors during growth, and the bones are formulated and remodeled according to the stressors that are felt on the body as the fetus and the child grows. This clearly demonstrated during growth of long bones in the limbs of children. Let us now take one of the long bones and learn how this occurs. Cartilage model of a long bone forms. Small model of the long bone is formed by solid hyaline cartilage. This shows appositional growth and elongates. This cartilage model has a diaphysis in the center, that is the shaft, and epiphyses at the edges, which are the enlarged ends on either side, shaft and enlarged ends. And the whole thing is surrounded by perichondrium initially. Then in the scaffolding, chondrocytes in the center of the shaft starts to enlarge and resorb the cartilage. Cartilage matrix starts to calcify, and then because diffusion is reduced, the chondrocytes in this area degenerate. That means they start to die. Okay, so the chondrocytes in the center of the shaft enlarges and the cartilage becomes less here. The matrix gets calcified, and because of that, the chondrocytes die. Also in the perichondrium of the shaft, it develops osteogenic activity. So that is the perichondrium of the shaft, and just below that, cells there develop osteogenic potential. And then this perichondrium turns into a periosteum. Then layers of bone matrix is laid down underneath this now newly formed periosteum. Blood vessels and mesenchymal cells invade the space left by the dying cartilage cells in the center of the shaft. These mesenchymal cells differentiate into osteoblasts and marrow-forming cells in the center of the shaft. The osteoblasts form layers around the degenerating cartilage and start to synthesize, lay down bone. This area is now called the primary ossification center. So, in long bones, the primary ossification center is in the shaft of the bone. The cartilage keeps enlarging by appositional growth on the ends of the bone, on the ends of the developing bone. The whole of the shaft progressively is replaced by bone and bone marrow. Now remember, the cartilage does not turn into bone, it is replaced by bone. Now later, what are called secondary ossification centers appear in the epiphyses. Now this is the first secondary ossification center, and this is another secondary ossification center. blood vessels will grow into the secondary ossification center and bring in osteoblastic cells. And the cartilage surrounding this area keeps on enlarging. Because of the appositional growth of the cartilage, these long bones are now slowly elongating. If you looked at the pictures carefully, you would have seen that the long bones are enlarging. So in a fetus, this will be happening. And then at certain point, the fetus will be born as a child, and this process will continue until the child has reached adulthood. The primary and the secondary ossification centers will grow towards each other. So that's the primary one. That is the secondary one. This will grow towards this way. This will grow towards this way. The cartilage in the middle will keep on thickening. And then a rim of cartilage will be left between the secondary and the primary ossification center. And this part is called the epiphyseal growth plate or the epiphyses of a long bone. So this rim of cartilage in the middle is the epiphysis. It is the one that keeps on growing until the child has reached adulthood. Growth in this cartilage plate continues until adulthood, helping to elongate the long bones. At a certain age, the epiphysis will fuse and there is no further growth or elongation of the long bones. A rim of cartilage is preserved at the ends of the epiphysis as articular cartilage. We discussed this in the previous lecture. A lot of people were asking about it. So this hyaline cartilage which is left becomes the articular cartilage. However, the perichondrium surrounding that area will be later removed. Now this picture shows you just the things that I was discussing. So there is a cartilage, a bone formed by cartilage, which is replaced in the center by ossification by osteoblasts and osteocytes. Blood vessels grow into it. Then secondary ossification centers develop, and the primary and the secondary ossification centers grow towards each other. The cartilage between the primary and secondary ossification centers are called the epiphyseal plate or the epiphyses. And then finally, as adults, these epiphyses will fuse and the whole long bone will be a continuous block of bone. Right at the edges, you have some articular hyaline cartilage left, and that will become the articular cartilage. So that will complete the growth of long bones. Now this is a histological section, the special stain of the epiphyseal growth plate. This is bone, this is the primary ossification center, this is bone, the secondary ossification center, and this is the cartilage plate or the epiphyseal growth plate where the cartilage cells are dividing and increasing in its thickness. So you can see the different layers of the epiphyseal plate. So now let us look at in detail the layers of the epiphyseal plate. The first layer is called the resting cartilage, where you have normal hyaline cartilage. Next one is called zone of proliferation, P. Okay, here the chondroblast starts to undergo proliferation to form columns of chondrocytes. They divide and form chondrocytes. Then there is the zone M, which is the maturation zone, where cell division has ceased and the chondrocytes increase in size. You can see that these chondrocytes are larger than these. So here they divide and here they are now enlarging. Then below that you get the zone of hypertrophy and calcification. So again, these chondrocytes become really large here and they develop vacuoles. Okay, they develop vacuoles. That means they have water getting filled into this, right? And the matrix in this area becomes calcified. So this reduces the diffusion, and because of that, these cells degenerate. So you come to the zone of cartilage degeneration, D. the chondrocytes degenerate and the lacunae of the calcified matrix are invaded by osteogenic cells and capillaries from the marrow cavity of the diaphysis. Okay, so in the shaft, you get calcified matrix with the cartilage cells dying and osteogenic cells and the capillaries coming in there. Okay, and then you have the osteogenic zone where the osteogenic cells differentiate into osteoblasts and start to lay down bone. So they produce bone matrix proteins, and these cells now are osteoblasts, and they get trapped in the matrix and become osteocytes. The transitional zone here is known as the metaphysis. Here again, you can see another H&E section of endochondral ossification. You have the cartilage, reserved cartilage zone, proliferative cartilage zone, hypertrophic cartilage zone, calcifying cartilage zone, and below that, you have the newly formed bone with the intervening bone marrow. You should be able to understand how the epiphyseal plate works and name the different layers of the epiphyseal plate. So the most important part in endochondral ossification is the epiphyseal plate. Now this is an X-ray of a newborn baby. At birth, all the long bone shafts are ossified. That means all the primary ossification centers are there. However, secondary ossification centers start to appear after birth. So here you can see all the long bone shafts are ossified. There may be a few secondary ossification centers, but most of them are not there, right? So at birth, all the long bone shafts are ossified. Now this X-ray shows you ossification centers of the hand, which is very important in a child where you want to figure out their bone age, what is called their bone age. The best place to do this is an X-ray of the hand. Now here you can see the phalanx. These are the primary ossification centers of the phalanx, and these are the secondary ossification centers of the phalanx. Here you can see the head of the metacarpals, okay, which is a secondary ossification center, and the shaft is a primary one. Here are the carpal bones, so you can see only some of the carpal bones are ossified. Carpal bones are the really good indicator of the bone age of a child. If you count the carpal bones, you can roughly judge the age of this child. Also, you can see the radius, right, to see whether the radial epiphysis is closed, ulnar epiphysis is closed, whether the ulnar styloid process has ossified. So these different features of the different areas of ossification gives you an idea about the age of this child. So here you see some ages written. Metacarpal closure. That means this epiphysis will close at the age of 14 to 21 years. Then phalanx closure, again 14 to 21 years. So this epiphysis will close at 14 to 21 years. Then radius styloid process closure may be variable. Radius closure in males 19, in females 17 years. Then ulnar closure, males 19, females 17. Ulnar styloid process closure 18 to 20 years. Right? So in this child, the ulnar styloid has not started to ossify. So like that, you have different epiphyseal plates and different ages for these epiphyseal plates to close. Right? So all epiphyseal plates are generally closed between 21 and 25 years, where the person will achieve adulthood and will not grow after that. So their long bones do not grow after the epiphyseal plates have closed. Now here you have a chart which shows you the different primary and secondary ossification centers and at what age they close and what is there at different ages. At birth, in the humerus, you will get the diaphyses and the primary proximal epiphyses, that is the head of the humerus. Then at the age of 2 to 4, you will see that the greater tubercle appears, ossification center of the greater tubercle appears, and then at the distal shaft also you get 2 ossification centers appearing. Then at 10 years, they are growing more and more. And at 15 years, you see that the lower ones have closed. Okay. And then plus 16 years, you see that the whole of the humerus is now ossified. There are no ossification centers here. Right. So like this, you will get different charts like this for the different long bones of the body. Now, you do not have to study all this, right? You just need to understand the concept. Okay. Now here you see an X-ray of the epiphyseal growth plate in the knee. So this is the knee joint, and this is the tibia, and this is the femur. So this is the epiphyseal plate. Cartilages appear clear in X-rays. They have less opacity. The bones appear white. So these lines here are epiphyseal growth plates. So you know that this is a knee joint of a child. This is the ankle joint showing you the epiphyseal growth plate. Now, if it is partially closed, and if you do not remember that there are epiphyses, you might think that this is a fracture. That is very dangerous. So you need to remember that there are epiphyses. You might either mistake epiphyseal plate for a fracture or miss a fracture thinking it's an epiphyseal plate, right? Both things cannot happen. So you must remember this. Here again are the different, now this is the femur and the tibia showing you the different ages where the different ossification centers appear and at what point they close. So general idea about this is more than enough. You don't have to study the different ages. Now let's look at some clinical correlates of all that we have learned. Fractures of bone. What is a fracture? That is basically the loss of continuity of bone. Now here you can see a fracture of the shaft of the humerus. The shaft of the humerus is broken at this site. If you go carefully on the side, you see that there is a gap. Okay, so this dark area, the dark white area is actually the cortical bone. The medullary bone is shown is slightly less opacity. Okay, so you see there is discontinuation or loss of continuity of bone, and that is what we call a fracture. Now let's learn about bone healing a little bit. We discussed this earlier as well during our previous practical session when students ask questions. Now bone healing, when the fracture occurs, what happens first is that as bone is extremely highly vascular, a blood will flow and a blood clot will form around the fracture site. This blood clot will be highly vascular and it will be replaced by highly vascular collagen tissues, which we call granulation tissues. And these blood vessels will slowly contract and this area will becoming more and more fibrous. After a while, mesenchymal cells there will differentiate into chondroblasts and progressively replace this fibrous granulation tissue with hyaline cartilage. And it will be strengthened by the deposition of calcium salts within the cartilage matrix. Then osteoprogenitor cells in the endosteum and the periosteum will get activated and lay down a meshwork of woven bone within and around this cartilage. And this part will be called the bony callus. Then bony union will be achieved when the fracture site is completely bridged by woven bone. Then under the influence of functional stressors, the bony callus is slowly remodeled to form mature lamellar bone. Bone will only be able to achieve about 80 to 85% of its previous strength when it fractures. Now here you can see the callus. Now this is the tibia and this is the fibula. So there's a fracture and the bone is not being aligned. Okay, so if this patient went to a doctor, these bones would be aligned and the callus won't be this big. So more malaligned the bone fragments are, larger the callus. So the callus can be palpated because it's made out of bone. So if you take a X-ray, 6 weeks later, you will see a callus. Then if you take one about 3 months later, the callus will be remodeled. But because these were not well aligned, you won't get the perfect healing. So that is the reason why doctors align the bones together and put what is called a plaster cast. Or you put a fixation. You fix the two bony ends together so that callus will be less and the bone healing will be much better. Now let us look at some diseases which happen to the bone, what we call osteoporosis, which is extremely common. This is reduction of bone density. This occurs in postmenopausal females and they can lead to fracture of bones. In a normal bone, there are gaps like this for the marrow, but in osteoporosis, these gaps are much larger. So this is reduction of bone density. This is not just reduction of calcium, but also reduction of the bone matrix, which is formed by bone. Formed by proteins. So both components of bone, the mineral as well as the protein component, is less in osteoporosis. So to prevent osteoporosis, you have to take a balanced diet of protein and calcium when you're growing, right? Taking a high calcium diet after you are old, after 60 years, is not going to help. So osteoporosis weakens the bone and even a slight fall can cause fracture of the bone. That is why you see a lot of fractures in the elderly. Now this is an X-ray of the hand to show you features of osteoporosis. Osteoporosis is difficult to diagnose. Now here you can see that the opacity of the bone is slightly less than normal. So this can be used. However, there are different tests to check for osteoporosis now. Then one of the commonest fractures that you see in people with osteoporosis is fracture neck of femur. Okay, and you see this in the elderly. The typical history is of someone slipping and falling and on a flat surface even, and this minor trauma causing fracture of the neck of the femur. This is very debilitating. This occurs in elderly females mostly, and this reduces their mobility and can lead to a lot of different complications. Then to show you a bone tumor, this is called osteosarcoma, extremely aggressive tumor which can lead to the death of the patient. So if this occurs, you have to amputate the limb, that is cut off the limb. Then you can also get what are called bone secondaries, that is the metastatic deposits from different tumors that can come to bone. Bone is highly vascular, so whatever different tumors like breast cancer, maybe bowel cancer, thyroid cancer, prostate cancer, all of them can send deposits which can go into bone, right? So this deposition causes bone secondaries to form. So bone is one of the places you commonly see secondaries, secondary metastatic deposits of cancer. Now let's look at what we call bone age. As I told you, different areas of the wrist is the best place to check bone age. At birth, all the shafts of the phalanx and the metacarpus have the primary ossification centers. Then 1 to 2 years, you get secondary ossification centers forming And here you can see 2 carpal bones are ossified. So very easy. You count the number of carpal bones and that equals to the age generally. Then 11 to 12 years, the pisiform shadow is visible through and between the hamate and the triquetrum. So like that, this is the pisiform shadow. So like that, at different ages, you get different carpal bones ossifying. So the general rule is count the number of carpal bones and that gives you the age. That is at very young ages, right? Okay, so this is a hand wrist radiographs, Atlas of Gucci and Pyle, 1959. So they made this these photographs to show you the different ages. So 1, 2, 3, 3 years, 1, 2, 3, 4, 4 years, 1, 2, 3, 4, 5, 5 years, then 6, 7, 8 like that, right? So the ossification, the number of carpal bones that are ossified in the wrist in a child can tell you the bone age of that child. Now, bone age is important because in some children who don't grow properly, the bone age may be less than their age. Okay, so then you need to know why the bone is not growing properly. All right, and also epiphyseal plates and ossification can happen prematurely. So premature close of epiphyses will cause short stature. Okay, the person won't grow up to the maximum potential.